So in last chapter, we discussed about social proof, which is very important, which is the most important decision-making factor for your patient. You need to have it. You need to have very strong social proof, whether it's on Google, whether it's on Facebook, whether it's Practo, whether it's any other tool where you present, any other booking software where you present, wherever patient can see you, you need to have a great social proof, right? Okay, so now let me talk about the information that we captured last time. I had asked you to capture the phone and email of your patients. It is for a very important reason. The reason is that I wanted to create a mini CRM. What is a CRM? A CRM is a customer relationship management tool. I'm not going to ask you to create something very complicated. It's going to be very basic, very simple. Right? You just need to automate. We are going to use some amount of marketing automation over here, and you are going to automate your relationship with your customer, which is essentially your patient. Now think from a patient's perspective for a minute, right? When the patient comes to you, you give him the treatment, and then the patient goes back and uses the treatment, and you don't know whether the patient is recovered or not. The patient also might recover, which is great, but if he does not recover, he'll either go to a home remedy or go to some other doctor. Now, if he uses a home remedy or another doctor, in either case, you have lost the relationship with the patient, right? Because the patient thinks that your diagnosis is bad and it does not work, and he or she will not come to you again. That happens so often, and all the patients that you lose are typically in this category only, because they're not happy with your service, with your treatment, with your diagnosis, with your fees, whatever. Now, to solve this, you have to make sure that you look at a patient and you create a relationship with the patient. You automate your relationship by sending him SMS and email at regular intervals. For example, when a patient comes to you, you send a follow-up email or follow-up SMS or even a follow-up voice call after a few days saying that, are you fine? Are you okay? Are things fine for you? Do you have any problem? Are you happy with the treatment that I offered? Most of the patients will value this so much that even if the treatment did not work, they will again come to you because of that relation. Now, how do you automate these things, right? You can use certain softwares. Now, I don't want to recommend any software, right? I mean, there are lots of them available in the market, but you pick up any marketing automation tool for SMS or for email or for voice. You check out the ones that are great for you, the ones that are in the right price range and are very simple to use. You can customize the SMS message, you can customize the email, you can customize the voice, automated voice calls that goes, and create a frequency that, say, when the patient visits you after 3 days, he or she gets the first SMS. After 4 days, an email. After 7 days, a voice call. If the patient has recovered, then you send them some information, some health tips, or any other information that you want to share. You create a simple flow. For example, I have a flow of emails that go to you every few days. Now, those emails are automated. I don't sit and type an email every time for every student, for each and every one of you. Obviously not. They're all automated. If you have signed up for a particular program, you get an email. If your payment failed, you get another email. If you dropped out at the payment stage, you get another email. But say if you signed up and you are in a particular course, then you get a certain set of emails. And those emails are thought, because I want to maintain that relationship, because I want to make sure that you are not just learning but you are implementing these concepts. I'm not going to talk again about implementing. I think you already understand the importance of it. But the idea is automating a relationship, automating the care that you should show to your patient. Think of the patient as your friend. Obviously, you don't have the time to talk individually to all your patients. So that is why automation comes. That is where automation comes. And automation solves all these problems. Start using a mailing software, start using an SMS software, start using a voice software. It is very important, very critical. If you want to succeed, if you want to have a lot of patients, if you want to treat a lot of patients, you need to have a long-term relationship with every patient that comes to you, because that will also help in referrals in the future. And we'll talk about referrals in the next chapter. But right now, the idea is only to show that you care. You're not just out there to diagnose, to write a prescription, and to tell the patient that take this and you'll be fine. That is not the only job. Your job is to make sure that the patient is actually fine. He is actually good and he is actually happy and he is actually satisfied. And satisfaction is difficult to achieve, but if you have a relationship with your patients, then it is very, very easy to achieve. The next stage of satisfaction is loyalty, and the next stage of loyalty is advocacy. Advocacy is all about referrals, and we are going to talk about referrals in the next chapter. So before that, you implement this automation, this CRM for yourself, so that you can progress from satisfaction to loyalty to advocacy. I'll talk about that in the next chapter. See you soon.